was a time
So what
when
do you want to
I
watch?
was
You want
low, and my
to
mum said she'd been
watch
talking to
this
me for 10,
recording?
20
So
minutes,
do
and I
you want
hadn't really been
to
responding.
do the
Like, while
catch
we were
up?
just
Do you
watching
want
TV or
to
anything, so I
speak to
wasn't
the
aware she
panel? Do you
was
want Penny?
speaking.
So when my blood sugar's low, it's kind of
Brilliant.
like
Penny,
my hands are shaking.
Penny,
It
you paying
feels
attention?
like I'm kind of
Your hand's shaking a
weak in
little
my
bit.
body, get like blurred
Ooh,
vision.
You can't really speak. You touch my hand and you say,
can get you
Penny,
some
I think
help.
you're sweating.
Let
Are
me
you
just
low?
get you
I
some
think you're low.
glucose.
You go and get me some
Okay, hey,
Lucozade, and
here's
even
some
though I can't really
glucose. Come on,
say
take
whether
it.
I am or not, I just can drink it back myself.
So my name is Eleanor Lotsu. I am 21 and I was diagnosed with type 1 diabetes when I was 6 years old.
So my name's David Mansfield. I'm 31, and I was diagnosed in September 1998.
So what age was that roughly?
9.
My name is Penny Whitehead. I'm 60, and I was first diagnosed when I was 7.
Do you use daily insulin injections or a pump to control your blood sugar?
So I have an insulin pump. It's connected to my stomach 24/7. You've got to change it over every 3 days, which isn't great, but I mean, it's keeping me alive. So yeah.
Insulin injections 3 times a day.
How much did you take?
3. That'll be enough. That'll be enough.
Is keeping the sugar levels balanced ever a problem for you?
Yes. I have a sickness problem. I vomit most days. I take insulin for meals that I'm then losing, so I quite often go hypo. Or the stress of being sick can push my sugars high, so it's unpredictable.
Yes, it is. That's entirely my own fault because I just don't measure my blood sugar at all. I just do my insulin, eat what I want, and if it goes low, I rectify it. And if it goes high, I don't really do anything. Okay, well, this is my current prescription.
The virus obviously can be more of a problem for people that do have diabetes. So has it been harder trying to like isolate knowing that fact?
It's been difficult, especially in the first lockdown. I think everyone was just very scared, and anyone with underlying health problems would kind of be immediately at risk. But the research was showing that people with type 1 diabetes, if their blood sugars are like well controlled, then they're not as at risk as people with uncontrolled blood sugars. So I was worried, but in lockdown, my blood sugars had been very good and I was controlling my diabetes really well. And there's a number called HbA1c, which is like your average over 3 months, and it's meant to be around 7. And I got mine down from 11.4 to 7.6. So it has been good.
We're not more susceptible. It's just if we get it, we're going to land up in hospital. I've stayed at home, really stayed at home all the time. It's just been miserable. I know it's been miserable for millions and millions and millions of people, but it's just been really miserable for me. Well, when I've had my second jab, I'm really looking forward to going out and about, going to the cinema, going to the shops. It'll be really cool.
How much do your friends and family support you?
So with diabetes, obviously when I was a child, I still did like my injections myself, my blood sugar tests, but my mum really helped me. Like she some days would just do everything for me and just like teach me how to do it, come to each hospital appointment obviously, and just be really supportive. In the primary school, people would be quite supportive, and teachers and people were just kind of interested to know, oh, what's that kind of on your belly and why are you injecting yourself? And then I'd explain and make sense. But yeah, my friends were good about it, and my friends still are to this day. They all know that I've got diabetes, and if I need like a minute to sit down and just check my blood sugars or things like that, then they're all really supportive and know that sometimes I have to take a little bit of time just to let my blood sugars either come down if it's gone high, or if I'm low, I just need to have some sugar.
They always support me in the fact if I go low, you and Grandad, or you mainly, do help and call the ambulance. If in my life people had forced me to do my blood sugar twice a day, I'd probably be in a lot better position. I would have a habit, and I haven't got a habit. So they've supported me in my rebellion over it. You don't ever nag me to do my blood sugars. Robert, can you go and get me some crisps if you don't mind? And I'll just have a bit of insulin.
Yeah.
How much are you supported by the NHS and healthcare industry at large?
Quite a lot, to be fair. When you're in the children's clinic, you get an appointment every 3 months if like your diabetes is at okay control. If it's like really good, then you get it every 6 months. At the moment I'm doing every 6 months, but with like a phone call each 2 weeks, just so I can get any help I need, or if I've got like a pattern of blood sugars that keeps happening at the same time every day, then I can like ask them for help and stuff. So yeah, I'd say they really are supportive. And for example, like the insulin pump, they cost I think about £4,000 each, and obviously I didn't have to pay that, it was on the NHS, so a lot of like gratefulness towards them. But yeah, I'd say the NHS have been really supportive, and they do provide a lot of help for me, my family. Like we got to go on this diabetes holiday this weekend away. That was quite fun.
Well, they pay for the pump, obviously, and all my supplies. So that's a great deal of help. And I see the doctor. Lately, it's been on web chat every 3 months or so, and that's been great help.
Have you had any moments where you've gone low in a public setting? And if you have, has anyone helped you?
I've never been so low that I've needed help, but I have had hypos. I suppose there was one time I was on a train and it was very hot and I went a bit low. Some of the other passengers just asked if I was all right, and they helped. I didn't know where I was going fully, so they helped guide me to where I needed to be. But they didn't need to like pick me up or anything. Just I was a bit sort of visibly shaken and I'd say probably a bit confused, but not anything worse than that.
Yeah, a few times, and yes, they did, either by calling an ambulance or getting me some sugar if I was able to speak enough to say I'm a diabetic.
Do you think that the public are aware of the issues that people with diabetes face, and how can they help?
I'd say people are pretty aware that it exists. When I was diagnosed, I'd never heard of it before, whereas now you see it mentioned on TV and things regularly. Although I'd say it's mostly type 2 that gets mentioned. I'm not sure what more they could do, really.
I don't think everybody is. I think people have the impression that, oh, you're a diabetic, therefore you can't have sweets or you can't have sugar, or which isn't the case. You just have to have enough insulin to cover it. And they probably aren't aware enough of the complications, and to be a bit generous and tolerant and don't tell you off if you go low. Because sometimes when I've been at work, some of my old bosses sort of got a bit cross with me when I did go low. God, she doesn't watch this, but you know, I think sometimes people don't really understand and they think it's your own fault. During this time you've made this film, I've actually gone really badly low twice during the night, and you've had to call an ambulance. And they were interesting. The first time, they just basically were telling me off. Not to the start with, but there were a few snide comments about, do you do your blood sugar and when did you last get checked and blah blah blah. And they had like they were all trainees, and it was just they just made me feel really guilty.
Yeah, well, it was that, and also like, you know, they were pretty slow. Like, they took 10 minutes to just set up a simple glucose transferal.
Yeah. I think probably because they were all in training. I don't know, but anyway, I mean, you know, I'm glad they were there because they saved my life. But then the next time it happened, it's about 3 weeks later. I'm going through a bad phase at the moment. They couldn't. There were two of them. They couldn't have been nicer. They were just because one of the ambulance people was type 2 diabetic, and he was telling me about encouraging me, and you know, he never because I kept apologizing once I could speak, but he was just really nice and really helpful and recommended these glucose shot things that I've now got. And so yeah, he was really good. They were really good. So you just never can tell, really.
Mm-hmm.
Do you think that the healthcare industry is ignorant in any ways?
I wouldn't say ignorant. Maybe sometimes they don't pay enough attention to how they're making you feel in your appointments. Like if your blood sugars haven't been good for like a year or a few months or something, they'll say, oh, we're gonna have to take away your pump because you're not being safe on it and go back to injections. And obviously no one wants to do what I was doing, 8 injections a day. Like no one wants to do that. You'd rather just have a little tube in your belly. Just, it's much easier. I just have to press a few buttons. But yeah, sometimes the things they say, it doesn't make the patient feel like the best diabetic. Sometimes they make you feel like a bad diabetic, and that's when you're kind of like, it's not a competition, it's just how things affect you, and it's just how you handle your diabetes.
To some extent, yes. I would say that if your average blood sugar is a certain level, that tends to be all that they really look at. So, for example, as I said earlier, I get a lot of highs and a lot of lows. So the average is going to be somewhere in the middle. I'm quite often told, oh, you're doing okay, just keep going. Whereas I would say that there's more help I could get in looking at specific areas of where I'm a bit high or low, and little tweaks that could be made to my settings that just seem to get a little bit ignored and left for me to work out myself.
No, they're not. They're not ignorant in terms of treatments and in terms of clinically how do you manage diabetic patients. They're very good. I've been in the hospital a few times with my diabetes, and they do go over the top a bit. But what they are ignorant, I think a lot of the nurses don't really understand the psychology of it, or they don't really understand how to encourage people to manage their diabetes better. Or perhaps it's just me. Perhaps I'm just so stubborn that I don't take any notice of what they say.
How could the NHS help to make living with diabetes easier?
Courses like the Daphne course that I did, which is dose adjustment for normal eating, were very helpful, and they could probably do more of that. And since I did the course, I've not really had that much of a follow-up. I feel like they're pretty good at getting people to do these courses, but then once you've done it, you're just sort of left on your own a little bit, and they could probably improve that.
By making all of the technology that's available to diabetic patients available to everyone, but all the young diabetic people I know have been offered pumps. Once pumps were available, they just thought I was over the hill, nearly blind, too old, going to die, don't bother with her. And also they've got these new fantastic watches. You wear this watch attached to your skin, and then you press the button and your blood sugar comes up, so you don't have to prick your finger, you don't have to do any of the faffing about you have to do. And I think I would use that, and I told that to the last diabetic consultant I went to see, and he said, there's a very long list of people waiting for it. But I think that should be standard, because I think it would help an awful lot of people and make life a lot easier for us. So this is my brand spanking new automatic blood sugar reader. It's going to cost me £100 a month, but I think if it helps, then it'll be worth it. So there's my blood sugar, 7.2. What's it like being a non-professional carer for a person with type 1 diabetes?
Harder and easier than being a professional carer. I'm kind of glad because, I'm not like in a position where I have to constantly monitor you, constantly check whether or not you're doing what you're supposed to be doing or what I'm assigned to be checking that you are doing. But at the same time though, it also then means that I don't have as much of an understanding of what it's like as somebody who might have gotten more training on it. But that being said, because I've lived so long with you, I know the basic ins and outs, and what that then means is that whenever you're okay, I don't need to worry. I only need to worry whenever you're not okay. I only need to worry anytime you go low. And and you're kind of on and off in that regard. Sometimes you've had periods where, to give a bit of context to viewers, Penny, she has sometimes had periods where she has gone low a couple of times in a row, but months have gone by where nothing has gone wrong at all. So in that sense, it's hard, because then that means that the times where she does go low are harder to predict, harder to deal with, because they can be unexpected. But at the same time, they've happened enough to where I kind of now know what to do whenever they happen. Basically what I know I have to do is I have to just bring her around, and normally that's by giving her something to drink and then giving her something to eat. It's normally in that order as well, and I'm used to doing that. I understand how to do it, and I've kind of gotten past the point to where I'd be so concerned about it that I'd call an ambulance. But last year at a couple of different points I did have to do that.
How can both professional and people who are placed in the position of being carers from time to time be assisted further?
Both of them can be assisted partially by the person who they have to like kind of care for. Like the person who they have to care for, try and like give them less actual work to do. It's kind of different depending on whether it's professional or non-professional. I mean, for a professional, so the people should be well trained, they should understand what they're doing, but if there's anything specifically that could help them out, it would be something that would also be helpful for the person they have to care for, which would be like, say, a watch that tells them what their blood sugar is at all times, or some other way of instantly knowing what their blood sugar is. So therefore it doesn't always just have to be when they're low, you know, like they can kind of detect if it's already going a bit low.
Yeah.
Like they're not outright low, but it's going a bit low, so therefore they can prevent it. And the same kind of goes for non-professional carers. Like that could be useful for them too. For a family member or, I don't know, a friend or whatever, it could kind of just make them less worried as well. It could kind of instantly tell them, oh, okay, there's nothing to be concerned about, or there is something to be concerned about. The more help the person who needs to be cared for gets, then the easier it will be for the carer.
So do you think that carers should receive any training?
The only training I've ever received has really just been experience, arguably. Yeah, I mean, and that would probably make them professional ones, or it would like bring them closer to being professional ones. If they're professional, then yeah, obviously, I mean, that should kind of go without saying. But if they're not professional ones, then there could be some sort of guidebook, or maybe online thing that they could always be referred to, you know, or have some website that they could go to, and then they could just be told everything that they would need to know. Or maybe they could, again, get a guidebook, or just get something else, you know, just something that would like help them understand, you know, and help them know what to do as well.
What do you think, what could I do to make your life easier with dealing with my, you know, me going low or me not being able to see very well?
Like currently you haven't really had any issues. I would say maybe would be a good idea, and to maybe have like a set diet or something, to have like a set things of that you can eat every day that kind of keeps your levels consistent with the amount of insulin that you're taking, you know. So therefore you can kind of keep a balance. I think maybe a set thing of like, I'm gonna eat this, I'm gonna eat this, I'm gonna eat this at this time, I'm gonna eat this at this time, and then I'm gonna eat this in the evening or whatever. Something like that, combined with the amount of insulin that you have to take every day, would probably be a good idea, because although you kind of have a set thing of like, you know, breakfast, lunch and dinner, it would be good if maybe you, like maybe not all the time, but like for a month's period or for a few weeks, you could just kind of challenge yourself and say, every day I'm just going to eat this, this, and this. And then that could maybe be a good way of keeping it to a level that you want, you know? It could even prevent you from going high as well. Like, it wouldn't just be about going low, it would also be like, you could take stuff that could avoid you going high, you know?